Okay, let's clear up another myth here if we can. If you're suffering from back pain, you may think that surgery is your only option, but I'm here to tell you this morning that a lot of folks that we've had right here on the program are swearing by something called spinal decompression, a totally non-surgical way that for many folks, they describe it as a miracle to get rid of their pain. Dr. Nicholas LaHood is here today from the San Diego Spine and Disc Laser Pain Center to introduce those of you that have not heard about this to spinal decompression.
Mm-hmm. You know, Mark, 80% of Americans suffer from severe chronic back pain. That means they're waking up
at some time in their life.
At some time. You know, and they wake up every single morning with severe achiness or sciatic pain that refers into the leg, numbness in the feet or toes, or just difficulty walking.
So spinal decompression is a totally non-surgical method, and a lot of folks may be familiar with it, and it is just about what it sounds like. You take the pressure off the spine.
That's right. There's so many people that are receiving epidural injections and taking medications to stop or dull the pain and dull the nervous system. But the decompression, as you can see, unloads the stress off of the disc and pulls the disc safely away from the nerves without using any type of evasive surgery. It doesn't touch evasively into the spine. We just gently decompress it.
Now, what we're showing graphically here is pretty easy to understand. You take a little pressure off the spine, and the disc retracts back in between the vertebrae there, where it belongs and where it's supposed to be that nice cushion between the bones. Mm-hmm. But now if I stand back up again and put pressure back on that, what's to stop the disc from bulging right back out again?
Well, we know through research that the outer ligaments of the disc become cracked and torn. We use a deep tissue class 4 laser as part of our technology at the office to help seal up the cracks and tears that have occurred in the disc, so the tissue is actually stronger when you stand back up and walk around.
So folks, for the first 25 callers, the doctor will see you absolutely free and no obligation treatment to them because they're going to be able to tell.
We have a 90% success rate with patients with herniated or degenerative discs. So if you have an MRI that shows you have disc bulges, this decompression technology that we have is state-of-the-art. The laser facility that we have is state-of-the-art, and all of it contributes to a non-invasive way to heal the back long-term.
Yeah, and that's the key, folks, is this is not just something where you go get an adjustment and you'll feel better for a little while and then right back where you started again. The idea is to get you better permanently. And unlike the gravity boots that, those have been around for a long time and you can hang upside down and get some relief, take some pressure off of your spine, this is a kind of a pumping action. Explain why that's so important.
The decompression units that we use are all computerized. So we can set the parameters per the patient's body type. We can treat a 150-pound man or a 120-pound woman differently based off of their body type and based off their specific injury. So we angle towards the disc specifically, and it's computerized. So the computer is sensing the tension in the patient's back and with their disc, so it doesn't over-apply the traction to the ligaments.
And the pumping motion actually helps rehydrate the disc. It draws fluid back into the disc because it is primarily water.
The disc is primarily water, and it needs small particle hydration every single day. So if your disc is biomechanically altered where you're not getting fluid, you're bound to go down to that degenerative disc disease, and you're bound for your back to get worse, sort of a degenerative scoliosis type of diagnosis. But our computers, our decompression tables, will actually pull fluid back into the disc tissue and open up the disc space again. So there's a miraculous amount of improvement with the inflammation of the nerve, the sciatic pain. Patients feel better right away.
So folks, again, no obligation. Try this out for yourself. And just as importantly, if there's somebody in your life that is suffering from back pain and they're just reluctant to do anything about it, you don't mind if somebody calls and makes an appointment on behalf of somebody else.
That's fine. That's fine. We've got the deep tissue laser that you can see here, and it helps stimulate the patient's own mitochondrial response and helps open up blood flow to that damaged tissue. When the back is inflamed, the blood vessels are squeezed shut and the healing process is reduced. So this helps open up the patient's own body's ability to heal the area.
Folks, there's the information on your screen. Please don't suffer another day. And if you're considering back surgery, at least look into this at no cost, no obligation to you as an option before you opt for that, for that invasive surgery that's irreversible. Once you've done that surgery, that can't be undone.
you know, it's such a rewarding feeling to see all the patients in the program currently that are getting great results and the new patients that are excited about the results that they've already seen. So it's just such a great blessing for me to be able to help so many people long term.
All right, the first 25 callers, absolutely free, an exam with Dr. LaHood and 2 free decompression treatments followed by the laser treatment as well to help that back heal up. And you'll know within those 2 treatments if you're going to be a candidate or not after consulting with the doctor. So, doctor, thank you so much.
Thank you, Mark.
It's good to see you, and I'm going to actually stop by and say hi this afternoon. I've got some things that I need to pick up down at the office to help me with my nutrition.
Perfect.
You guys kind of handle it all. All right, for more information, you go to san-diego6.com and click on San Diego Living. But please, the first 25 callers absolutely free. So if the lines are busy, go ahead and call. Keep calling until you get through.